We are receiving essential supplies from the United States, but the United States also receives essential supplies and products and indeed healthcare professionals from Canada every single day. I think of the thousands of nurses, for example, who cross the bridge in Windsor to work in the Detroit medical system every single day. These are things that Americans rely on, and it would be a mistake to create blockages or reduce the amount of back and forth trade of essential goods and services.
So Canada's stockpiles of medical supplies like masks, ventilators and test kits are not enough if the country is hit by a surge of COVID-19, and things may get worse. After President Trump ordered 3M to stop sending those key N95 masks to Canada and to Latin America, how will Canada respond? Did the Prime Minister hint that Canadian nurses working on the Detroit-Ontario border should stop going over to Michigan in response? And after Ontario released its projections for deaths from COVID-19 between 3,000 and 15,000 over 18 months, best case scenario, if you can believe that, should the federal government also release their projections? Let's bring back the Scrum. Andy Bergeron-Oliver is back, so is Joyce Napier. Tom Mulcair is back, and our special guest this round is the president of the Canadian Federation of the Nurses Union, Linda Silas. Linda, first of all, great to have you here, and from all of us, please express our incredible gratitude to the nurses on the front lines doing extraordinary work in a time of crisis. Can you give us a sense, are they experiencing shortages in terms of critical equipment that they need?
Right now, Evan, they're experiencing total confusion and are being quite insulted because when you hear stories like the N95 respirators are locked behind closed doors, nurses, healthcare workers are told they'll be disciplined if they wear them, it is quite a chaos. Some regions are doing better than others, but we need to speed up our communication and speed up the protection of healthcare workers.
Just talk about that. The government has said for a long time we will have enough personal protective equipment. Are nurses telling you otherwise?
What they're telling us is that employers are panicking and locking them behind closed doors. Before March 8 around, nurses and healthcare providers were respected in their professional judgment. So when we enter any room, any contact with a patient, we do what we call a point of care assessment. So we decide what we need to take care of that patient, but also what we need to protect ourselves. And then we up the personal protective equipment, or we bring them down.
Right.
What employers have been saying is, no, you're only to protect yourself for droplet and contacts, regardless if you think that the virus, you might be infected through the airborne. And that's the friggin' debate with the mask, the paper surgical mask, or the N95 respirators that you need to be trained and fitted to wear.
Right.
And we've had enough.
Joyce, that's fascinating to hear that. I mean, that is stunning to hear, to be candid. My jaw's a bit on the floor to hear Linda talk about that level of frustration. But all of us, frankly, are experiencing a lot of confusion. Should you wear a mask out? Dr. Teresa Tam said, yeah, if you want to. I started wearing one when I went to the grocery store. Is mixed messages becoming a big issue here?
And I think, yes, it is. And I think that trust, you brought it up last week, and I think all this is under that banner, trust. Do we trust what they're telling us? First, they told us we're not going to close the borders because viruses know no borders. But they were only testing people who had traveled. So you're thinking, hey, that doesn't make really a lot of sense. Why don't we have enough protective equipment when we know that in January the Chinese blocked exports of those masks? So didn't Canada, having learned lessons from SARS, say, the Chinese are blocking exports of these masks, maybe we should stockpile them, but we did not. So I find that there's, you know what, they have asked people to abandon their businesses, to close themselves in their house, abandon their elderly parents as well. You know, we're all locked inside our houses, so I think it's time for them to tell us the ugly truth, seeing that we're all in this together. It's time to, you know, stop sugarcoating it and tell us what is going on.
Annie, some stunning moments this week. I think the relationship between the United States and Canada was tested in a way I think that stunned Canadians over this N95 mask. What does that tell you about the shortages and the need to be, quote, self-sufficient, even though we don't want to cut off the global supply chain? It seems like there's two competing visions here.
Well, I think what it tells us is that governments were trying to paint some type of a rosy picture over the last few weeks, that the shortages weren't really that much of an issue immediately, but they were doing things proactively by getting additional supplies and procurement. But what this shows us is that's not the case, that it is a dire situation both in the United States and here in Canada. We tried to ask the Prime Minister yesterday what would be the impact of 3M not being able to deliver these N95 masks, and Trudeau did not answer that direct question. Then we heard Ford yesterday talking about the fact that it appears that a shipment of millions of N95 masks were not going to Ontario. So I think what this shows is, yes, there is a massive shortage. Yes, governments are concerned, but this may just be the very first tipping point. We talk about all the ventilators that Canada is getting, but in terms of ventilators, you also need medication to be able to use those. So will there be a supply of medical necessary medication that is also in shortage? I think this is the beginning, and I think governments need to be very cautious, Evan.
Yeah, Tom, big picture here. You don't want the global supply chain to seize up, but this crisis is like the Donald Trump moment has clearly sort of changed. If you listen to Premier Doug Ford from Ontario, he was stunned that the U.S. would try to cancel those orders. If you're in the leadership, how do you respond to what the U.S. has done?
Well, I think that the best way to respond is what Mr. Trudeau's government has been doing. Minister Patty Hajdu came out front and center and said the national stockpile is insufficient. That's good clarity. It's transparent. Premier Legault had a serious alarm sounded at the beginning of the week. He was clear with Quebecers, we do not have enough, and we've only got a few days left. So everybody realized that at the same time, and we're doing whatever we can. We've hit a wall with our American neighbors to the south who have started blocking shipments to Canada. We've scrambled. We've managed to get into China, which was blocking shipments up until not very long ago, but now seem to have a decent supply. So we'll tap into that to the extent possible. But I think overall, Evan, the most important thing is to be clear, honest, and transparent with the public. Let them know that this is part of the health crisis.
Linda Silas, it was a stunning moment when the Prime Minister was asked about this, and he said, well, we've got thousands of nurses in Windsor that cross the border every day to work in Detroit and Michigan. Could nurses be used as tools in a war over medical supplies? What's your take on that?
No, they won't be used in a war for personal protective equipment. Nurses that are working in the U.S. Are as committed to their patients and those communities as they are when they're working downtown Toronto. So they won't be a pawn here. But what they're being a pawn with is what Tom was just explaining, from the federal health minister saying we will have enough or we don't have enough, and then the Premier of Quebec saying, oh, we'll run out in a few days. Those are big policies. You and I are very lucky that we work at home. We're protected with our own environment. But then these healthcare workers, nurses, doctors, cleaners are right there on the front line, and we need to protect them, and we need to tell them the truth and work with them to make sure we have solutions, not high political dancing that we're seeing between 2 or 3 countries.
All right. Well, listen, again, please pass on all of our thanks to the incredible frontline workers, the doctors, the nurses, cleaners, everybody that's on the front lines. I really appreciate it. Linda Silas, Andy Bergeron-Oliver, Joyce Napier, and, of course, Tom Mulcair. Great to have all of you. Take care of yourselves. Take care of your families. This is going to go on. There are going to be some very tough days ahead. This is not going to be easy. I know everyone's making a sacrifice, so be patient, be kind, stay home. We're all in isolation. But as someone told me, the virus has not isolated our humanity, not isolated our courage, not isolated our community spirit. Thanks all of you for watching. Take good care. We'll be back in 7 short days, and I'll see you Monday on Power Play.